Hi, this is Dr. Idara. This is a presentation about postgraduate seats in Gujarat state. This is only research data. I'm presenting the data, approximate data from the NMC website, NBME, and collection. I'm going to present a presentation. Here is postgraduate seats. Development of postgraduate to reach developed countries in Gujarat, one PG seat, one MBBS seat. So do we want PG seats equal to MBBS seats? I think so, in my personal opinion. USA, United Kingdom, do you want India or Gujarat to be like a developed countries, at least look at the model. That's my presentation. In America, 32,000 medical graduates, but 40,000 PG seats currently. And so does other states. And the main mission is here. Prime Minister Narendra Modi ji has set an ambitious goal to transform India into developed nation, Viksit Bharat by 2047. So we want to look at how the developed country did in the health PG seats. Developed country have more PG seats than medical graduate. USA has 32,000 medical graduate, as I mentioned. UK, you can look at 95,000. They graduate their own students. In family medicine alone, they have 936, but IMGs itself a lot more. This graph, which is connected to national register, non-UK doctors are 20,000 compared to registered in 2004 is 5,000. Actually, it's up to the 10,000. So there is a lot more doctors or PGs or graduate, almost twice than that. So we have actually half the MBBS doctors or PG seats. So this already vision, we thank Health Minister sir and Dr. And past Health Minister Dr. Manshuk Mandavia sir said goal of PG medical seat for one MBBS, and also is reconfirmed in 2025. Dr. Abjit sir, they are doing amazing work. They have created even almost 10,000 crores for increasing 5,000 PG seats. But I think there is some other options are there which can be increased with the least expense. Do we need every family should be under care of a postgraduate primary physician care? Now we have MBBS doctor. There's nothing wrong. MBBS doctors are good, but they don't have enough clinical experience. If they do 3 years of clinical experience, that's what the patients wants. So let's go to some numbers. Currently, NMC website says 7,525 MBBS seats present in 43 medical colleges in Gujarat state. And PG seats, NMC has 3,031 plus DNB 3, approximate 3,000 follow. It could be more, but it's approximate number. So there is a gap of 4,000. As more medical colleges recently came, I'm sure that will reduce it to maybe around 3,000. So, but currently 54% do not project to have a PG seats. Now it's reflected. We have 2.1 to PGP NEET exam taken, only 70,000 PG seats. So in the UK, they have 30% more PG seats, or America has seats than it is. So this gap is not yesterday's. It has been there in India for 40 years. Need to be addressed. How to reach the PG seats in each MBBS? Specialties we need to create. Identify, outline medical specialties that are currently lacking. And current specialty PG seats in Gujarat. How to create PG seats in specialties. Learn from developed countries. So let's see, dig into the numbers. So this is a detailed work I did. Some of the specialties I took, like ophthalmology, which America around 340 million, 1.54 seats per million. India, Gujarat doing good, better than America, 1.9 PG seats. So they have 30 more PG seats compared to America. But Gujarat may need more. But Gujarat Association of Ophthalmology and policymakers need to decide that. So if you look at the ENT also, we have 3 more seats than America. And pathology, we have 100 and more 1 seat. That's we have 3.4 per million. So these are doing good. And some other branches which are minor choosing, as we have more colleges open, I'm sure these are all will be addressed. Like dermatology, we need 31 seats more, and OBGYN 70 more, and surgery 35. They're already doing good, but these seats which with the new medical college, this can be addressed without any issue. But the things we need out of 4,082, the 2 branches we found is general medicine and family medicine and emergency medicine. USA 32 seats per million in USA for general medicine, but Gujarat have 4.94. And if you compare to USA, if you want to make that money number, we need to create 2,366 or 4,000 seats in general medicine alone. If you want to compare the emergency medicine, they need to go to 657. But again, Emergency Medicine Association, Gujarat policymakers has to decide. Family medicine is a big number. There are two models they're following. One is USA follow less family medicine, more in general medicine, but UK and Canada follow more family medicine, less general medicine. That's up to the government to decide in Gujarat. So let's go to the family medicine. Actually, now seats in family medicine in Gujarat and 15 per million. That means if you want to create 15 per million, almost 1,600 seats need to be go to the out of 4,000. These two seats itself can match up to the both family medicine, general medicine seats can create 4,000 seats. If you go for UK model and family medicine, 3,200 or 40% of PG seats in Canada are family medicine. I don't think India will go that far. So three categories we decided. Some of them are smaller, already efficient, equal or more. Some are the moderate increase with the new colleges. I'm sure that will be addressed. Significant deficiency in general medicine, family medicine. I'm just presenting to the data. Stakeholders are the ones, government, specialty societies need to decide. If you're the one who need to make the decision, I think our suggestion is like a task force which continues for and then they digest the data and then monitor yearly and present to the data to policymakers, health secretaries, and ministers is the right thing. My request. And again, these numbers I'm going again. Numbers out of 142 PG seats in ophthalmology, 1.9% come to America, 1.31. That this presentation data I already presented. So we'll go to the next ones. So these anesthesia, which also need have enough seats, but small numbers can be easily increased. The pediatrics need to increase more. But remember, we have a lot of rural population like Australia, and we need to address that issue. So that's where we need psychiatry also need another more increase of the seats. So general medicine, we talked about if you follow the UK model, we need to create 2003 USA model 2035 seats in general medicine, and the family medicine also we need to increase either 1,000 to 3,000 depends on your policy, government policy. How to create? This is most important. I like to find Vinod Paul sir. He's a Niti Aayog member. He's a former MCA chairman. Said every bed in India should be utilized for medical education. So I think medical colleges, especially after 10 years or more, are saturated with PGC. The room is very less to increase there. NMC did a great job increasing PG seats. Central government given 10,000 crores to increase 5,000 PG seats. So government is doing great job, but this data may help us to implement with the least cost. So where can increase the general medicine, family medicine? See, general medicine PG seats, 30 medical colleges, only 9 do not have it, and they can create maybe another 100 seats. But still, we're talking about around 1,900 seats need to create. There is empaneled hospitals, private hospital around 868 in Gujarat, which can be used. They have to have ICU, which can be used in general medicine, which is very common in UK, America. These kind of hospitals are used. This is where you use. You can have MOU with the medical colleges, so that way medical college can send their students, and then they can create private and government can empanel with MOU with them. That's why you can create more PG seats in general medicine. Family medicine, we can take advantage of the AIMS model. AIMS is amazing. They did a model where they did not put a 30-bed unit like NMC. They removed that. And also they put a coordinator. I think some AIMS uses community medicine. Some of them OBGYN medicine are definitely family medicine graduates are there available. You can put one coordinator so there is no burden. And then PG seats, students can be in the medical college or into the 100-bed, 50-bed and CHCs. You can rotate through them. I want you to submit to you United Kingdom, the general practice family medicine, MRCGP, which a lot of people like to get the degree, and they only rotate 12, they rotate 24 months in private clinic, not in the hospital, but only 12 months in the hospital. This data, we have so many hospitals in India, empanel hospital, 100-bed hospital, 50-bed hospital, so much infrastructure, so much volume. We can train our people, create PGCs, not only one-on-one, increase more than what our MBBS need, even provide to the foreign medical graduates coming back. So Why last 20 years United Kingdom increased 2025? They found severe work shortages. What did the UK did? They took a lot of funding there, like our India doing funding. So maybe additional funding to create for the infrastructure of the CHCs, family health centers, is very needed here. And a goal is to create the family medicine, which is and then care in the rural areas is important. And here in the UK, they 63 million people going to the general practitioners, and they shifted the community care from the hospital to community. This is most important. And I thank you for your kind time, and I hope this data will help policy changes. Namaste.